Hello everyone, we have a 53-year-old man who comes to emergency department complaining of sudden onset of intense epigastric pain, where he also vomited once, noticed sudden dull aching and diffuse abdominal pain, and it has been there for last several months. Abdominal ultrasound performed 2 weeks ago shows small stone in the gallbladder, and he has a 45-year back history of smoking with drinks of 1 to 2 beers per day. He has fever, and examination shows diffusely tender abdomen with rebound tenderness. There is increased pain in the upper abdomen when palpating after deep inspiration. Okay. Well, the X-ray is also shown. If you look into the X-ray, you can see this diaphragm, but you are getting air. So we are getting air under the right side of diaphragm. Whenever you get this is the remember. Golden line to remember, gas under right side of diaphragm, that indicate any organ, especially any viscous abdomen organ like intestine or stomach, has perforated. This is gas under diaphragm. Now let us see what are the options. I'll make the question very easy. Is perforation occur in Gall cholecystitis? Very unlikely. Here, unlikely. Here the gas is in the chest, not in the below diaphragm. Biliary colic? No way. Oh, now this is the answer. So question has become very easy. None of the four options can perforate. This perforation is there. So remember the golden line to remember, gas under right heart diaphragm is perforated viscous abdominal organ. Well, I'll discuss, although the answer we got it right now. So, but it's a very commonly asked question throughout the world, whichever exam you write. So let's discuss more about perforated peptic ulcer patient upside chest X-ray shows free air under right heart diaphragm, so-called pneumoperitoneum. Chronic gastric pain that suddenly worsen and become diffuse with pneumoperitoneum is concerning for perforated peptic ulcer. It means this patient has a long-standing peptic ulcer, but now it has perforated. Now, gastric secretion and content are released into peritoneal cavity. That is true for any rupture anywhere in the intestine, and that can lead to peritonitis, which can lead to rebound tenderness and guarding. Okay. And to establish early diagnosis, so because you have to diagnose very fast, and if it is more than 12 hours, it can become mortality increases drastically. So it should be operated immediately. Now there is a mention like guarding. Now I tell you the specific term we use. It's a board-like rigidity. So if you are in the question, you are getting this board-like rigidity, again, it indicates perforation. Of any organ, viscous organ. So that means if you are getting gas under right heart diaphragm, is the most confirmatory, but clinical diagnosis will be board-like rigidity, again indicates some perforation. Let's look into other option. Acute cholecystitis can present with epigastric pain and positive Murphy's sign, and it is more in females. What is Murphy's sign? Stop the video, write down the answer. Pain with palpation of gallbladder beneath the liver edge during inspiration. You are palpating, the patient is taking inspiration, there is sudden catch in the breath. It is virtually diagnostic of acute cholecystitis. It's very sensitive, but not so very specific associated with cholecystitis. But remember, for all practical purposes, when we are getting Murphy's sign, virtually diagnostic of acute cholecystitis. But perforation of gallbladder is very uncommon, as I mentioned. So Of course, it can happen when the development of gangrenous cholecystitis, but it's very rare. So definitely the best answer of this question was perforated peptic ulcer. Patient would appear more septic and perforated gallbladder. Asymptomatic gallbladder are common in general population. Like in this case, ultrasound was done. There were gallstones, but no symptom, nothing worry about it. Golden line to remember, positive Murphy sign is equal to acute cholecystitis, virtually for all practical purposes. Let's look into other option, gallstone pancreatitis, with a sudden onset of abdominal or epigastric pain, nausea, and vomiting. Abdominal radiograph usually reveal localized or diffuse islets of small intestine. Acute gallstone pancreatitis does not usually cause free air under the diaphragm. This is ruled out. Biliary colic, present with the episodic right upper abdomen quadrant or epigastric pain. Pain is due to gallstone pressing against the opening of cystic duct as gallbladder contract in response to fatty meals. They are usually not associated with sign of local or generalized inflammation. Imaging studies will reveal gallstone but not free air under the right side of diaphragm. So now this beautiful picture, you can see we have a gallstone which has caused obstruction, gallstone blocking the common bile duct, and that lead to pain. Same thing you can see in ultrasound. Just see lovely picture. Should not forget the gallstone and this shadow. Don't forget this. Well, pneumothorax, spontaneous pneumothorax present with sudden onset of dyspnea and pleuritic pain chest. Diagnosis is confirmed by white visual pleural line on the chest radiograph. Gas under right heart diaphragm is not seen. This again lovely. You can see this white line. This all gas is. This is pneumothorax, and there is a collapse of the lung is there. Golden line to remember. Chemical peritonitis due to perforated peptic ulcer would be suspected in patients presenting with sudden onset of severe epigastric pain that spread over the entire abdomen. Chest radiograph will show you gas under right side of diaphragm, and there is board-like rigidity. Thank you very much.